Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. Today our talk will be mainly on syncope, or what is fainting. This is a transient self-limited loss of consciousness due to active global impairment of the blood supply to the brain. It is usually transient, rapid, and spontaneous and self-limiting. It is account for about 3% of all the emergency departments visits and account for 1% of all hospital admission. The causes of syncope can be reflex. We have cardiac problems. We can have nervous problem affecting the vagus nerve, and then it can also be positional. So positional is where we have decreased the blood return to the heart due to standing a lot, or there is excessive loss of fluid from the body, which could be from diarrhea, sweating, bleeding, or even excessive urination. We have the esophageal, which can occur due to sudden psychological stimulus, leading to decreased blood supply to the brain and leading to fainting. You can also have cardiogenic fainting, which is usually caused by a cardiac problem, which could be tachycardia or bradycardia, leading to inadequate blood return to the heart and inadequate blood supply to the brain. The diagnosis is usually, the first thing is you want to be sure that the patient's airway is okay, you have good breathing, there is a good circulation, and the patient is stable. Then the investigations will include blood count to establish what is the blood level. You do an ECG is necessary to assess the status of the heart, and also accessing the blood pressure in the lying position and also in the sitting position, especially when you suspect that there is orthostatic syncope. The treatment most of the times for the major types, it's reassurance, and because for individuals, like for those who have stood a lot, it's just a change of the position that is necessary, and then the individual will be okay. Of course, the other thing is to evaluate for possible cardiac problems, which can cause, can be life-threatening, and those ones need aggressive management. For those who have any loss of fluid from many causes, then replacement of fluid is very necessary, and sometimes if the syncope is persistent, then there are some drugs that can be used to alleviate this. So in summary, syncope is a common medical condition which happens transiently, and it is self-limiting. Most of the times it is caused by esophageal reflexes, leading to inadequate supply of blood to the brain. But you can have causes from the heart which need to be evaluated and the necessary treatment given. Thank you very much for listening to me, and I ask you that you subscribe to our Wellness Health Services Health Talks for more information on various topics.